is Jason San Miguel, and today I'll be demonstrating how to properly assemble and explain the components of the oxygen tank. This process is essential for ensuring safety and effectiveness when administering oxygen to the patient. Let's get started. Next, we can move on to the regulator. The regulator is responsible for reducing the high pressure of oxygen in the tank to a safer level for the patient. The regulator reduces the tank pressure from 2000 psi to a safer level. The regulator also has a gauge for indicating the pressure inside, measured in pounds per square inch. In addition to the gauge meter, there's an additional gauge that displays the amount of oxygen that is flowing from the tank to the regulator to the patient. This flow of oxygen is controlled by the knob on the regulator, which adjusts the flow rate from the gauge in liters per minute. Typical flow rates range from 1 to 20 liters per minute. We can now begin assembling the oxygen tank. First, you want to inspect that the oxygen tank you are using is in good condition and has no visible damage from the body or from the valve. Once you have ensured that it is in good condition, you can now take your cylinder wrench or oxygen key and crack open the valve. Once that step is completed, this ensures that the oxygen tank has enough oxygen in the tank or pressure and removes any debris that may have been stuck in the orifices or pinholes on the side of the oxygen tank. Once you have ensured that that step is complete, you can then begin attaching the regulator. By attaching the regulator, you will align the regulator pins with the pinholes on the side of the oxygen tank. Once you have properly put them in place and aligned them, you can begin using the T-screw to securely and carefully attach the regulator to the tank. Be sure not to over tighten, as this may cause damage or any leaks from occurring. Once that step is complete, you will then grab your mask device. In this case, I'll be using the nasal cannula, and you will attach the plastic adapter to the open port underneath the flow meter gauge. Make sure not to over tighten the plastic adapter, as these can easily break with over tightening or stripping the threads. Once that is in place, you can then slowly open the oxygen tank. As you open the oxygen tank, you will see that slowly the air will flow into the regulator and indicate how much pressure is left in the tank, shown by this gauge right here. Once that step is complete, you can then adjust the flow meter. Adjusting the flow meter shows how much oxygen will be given to the patient through the regulator. And this gauge is located right beside the pressure gauge from the tank. Adjusting the flow meter will be used by this white knob, and there are different knobs with different regulators. In this case, mine is white and indicates which turn to increase or decrease the flow rate, as prescribed by the dentist or doctor. In this case, if a doctor or dentist may ask for 6 liters of oxygen, you will adjust by the knob right here. Once that step is complete, you can then decrease the flow rate all the way into its closed position, and then close the oxygen valve. Once that step is complete, you would then open the Once you have closed the oxygen valve, you then bleed the system. Bleeding the system involves turning the regulator knob or the flow meter knob all the way until any residual oxygen is left in the tank. And to ensure that you have reached zero, you would take a look at both gauges, the flow meter gauge as well as the pressure gauge, to ensure that both sticks have reached the zero mark on each other's gauge. Once that step is complete, you have successfully bleeded the system. You can then close the flow meter knob all the way to the closed position. And then you can now safely remove all the parts related to the oxygen tank. This involves the nasal cannula or mask, the regulator. Step prevents pressure buildup, ensures safety, and protects the equipment. Once that is complete, you may disassemble the components related to the oxygen tank. Proper assembly and use of the oxygen tank are vital for safe and effective care. Thank you for watching this demonstration, and I hope this has been informative.